one of the things that I have become aware of over the past few years is just how misleading politicians are about the NHS. And it's still going on. I mean, this week we've heard that the NHS is in a really good situation because we've got 1,500 GPs have been recruited. A couple of weeks ago, we heard there were 2 million more appointments being made. The waiting lists are falling. Everything seems to be going on the up. We've got Wes Streeting heading the NHS. I mean, what more could we ask for? That doesn't seem quite right, does it? And the thing is, the NHS is something that is so important to everyone in this country that politicians know they can't look like they're destroying it or they'll never get elected. I mean, it's just that's obvious, isn't it? I mean, they just can't look like that. So they have to present it in as many ways as they can that they are doing us the best reassessing the NHS, reorganizing it, making it more efficient, all these kind of words they use. And it gets really confusing. And the only person who I have ever got any sense out of on this is Dr. Bob Gill, who I would say he should be given all the awards that you could ever get, but he never take any, I'm sure. Not only does he tell the truth about it, and I would imagine, because I don't really know, but I would imagine that's a great expense to his own personal career, his professional career. I'm sure he's ostracized by other people in the medical profession because he speaks out, but he doesn't make a big deal of it. He is just constantly telling us the truth about the dangers of what's happening to the NHS, and he is also really articulate, far more than I am. And he really can put it into words that I can't do. So look, I'm going to shut up, right? And I hope I've given a good enough intro. Is that enough for you? Yeah, right. So please, I'll hand it over to Dr. Bob Gill, and I might come up with some questions after you've spoken.
They've been very clever. They've taken 4 decades to essentially repurpose the NHS away from its core principles into something resembling American managed care, the American Medicare, Medicaid system, which is publicly funded but delivered by private companies for profit, and profits are extracted through the denial of care primarily. So if anybody wanted to copy a system in the world, you would not copy the American system. They spend more than double we do per patient. They live shorter life expectancy, and their system is universally despised in America. Why would it make any sense for any rational person to copy the most expensive, most fraudulent, most dangerous system? Are we led by total idiots, or this isn't mutually exclusive, or a corrupt bunch of self-serving you know what?
Yes.
And you can say both to the above, right? If anybody thinks these reorganizations that Crispin mentioned are somehow disconnected, you're misinformed. They're all connected, and each policy stream, each act of parliament in terms of the NHS has been a progression to get us to where we are. They haven't been unconnected, but it's a useful political tool to blame the outgoing government and say we're going to do it differently and it's going to improve. But every time they embed more and more market and commercial change within the NHS. So what have been the outcomes of this successive change? Well, first of all, that principle of publicly funded, public employees delivering high quality care at lowest cost has been replaced by a very top-down system of a very expensive and bloated bureaucracy within a system which is mired with costs that were never there in a public system, transaction costs, writing up contracts, legal fees, monitoring of the contracts. This is sucking out 20 to 30% of the NHS budget. So be wary of any politician saying we need more money in the NHS when it is infested by parasites who are sucking money out. So you have the bureaucracy on the one hand, and you have the private contractors who are doing all the profitable, easy, straightforward work, and depriving the NHS of that work which it would be using to train the new doctors and nurses that are coming up. We are experiencing a denial of care. The most obvious one is if you lose your A&E department and you're seriously ill and you have to travel another 10-15 minutes down the road to an A&E department. Well, if you're critically ill, that might cost you your life. And I would argue your care has been denied. You can extend that to maternity services and others. Waiting lists are a brilliant way of denying you care, because people will either die on the waiting list, a very good outcome for the politicians, or they'll opt to remortgage their house and go privately. Or they will just suffer in silence and wait for the assisted suicide bill to become legal, which is what people were doing after the Second World War until they heard that there was this new health service coming. The suicide rate amongst the poor and sick dropped dramatically. But what we're seeing is people driven to suicide, and we're having the legal work done to help them along their journey. But don't forget, it's their choice. What they've achieved is deregulation through being regulated. Let me explain. The people who are replacing doctors were called physicians associates. Now were called physicians assistants. Now they've been made to sound a bit posher. They're physicians associates, and they're to be regulated by the General Medical Council. Now, let me remind you, the General Medical Council was set up 100 plus years ago to make sure that quacks weren't operating on the unsuspecting public. But how many of the public seeing a physician's associate knows that they've had 2 years training of medical studies, a course for which there's almost 100% pass rate, most of them getting a distinction, and they're replacing a doctor who's had 5 years at medical school and a minimum of another 5 years clinical practice? Is that replacing like with like? No, it isn't. Does the situation I paint really just affect people at the lower end of the socioeconomic spectrum? Well, actually, no. This is a threat to everybody. Even if you have the best insurance in the world, if you get run over by a car, you need a functioning A&E within a timely distance. If your A&E is shut or is staffed by Muppets at the front end, that might mean your life, right? Doesn't matter how rich you are. But even if you are very well insured, or so you think, there was an article in the Times, October 2022, making the case of a King's Counsel, a Mr. James Guthrie, who thought he was well insured with Bupa, who had a premium of £6,000, not cheap, but he could live with that. But he developed a cancer, and within 7 years, his premium went up to £164,000 per year. Because insurers aren't there for charity. They will price you out of cover. Their cover is based on how much you cost them the preceding year. And what did he have to do? He ended up relying back on the NHS. Now, this isn't common knowledge at the moment. People think insurance is great, but they should know whenever they've claimed on their car that what happens to their premium? It shoots up. So what can I say about Starmer? Well, Starmer promised the earth to get elected. He promised the earth to win the leadership of the Labour Party. He donned all the sort of progressive policies, I'll renationalise this, that and the other. As soon as he got into power, he was endorsed by people like Larry Fink. Larry Fink, if you don't know, is the CEO of BlackRock. BlackRock is a private equity fund which controls, I believe it's 7 trillion of wealth. They're heavily invested across the the stock exchange, and also in healthcare. They're a big shareholder within United Health and probably within Centene and probably within all these other organizations. So to get endorsed by Larry Fink, whose profit is made through privatizations and asset stripping, I put it to you, this is not a good badge of honor. And Starmer's quite happy for this to be published across the press. What about West Streeting? Surely we've got a bit of hope in West Streeting.
Oh, no, we don't.
Well, West Streeting, again, he got his seat by the skin of his teeth. It was a very good campaign. I think there was a few hundred votes in it. But I'm sorry to tell you, but he's received tens of thousands of pounds from people with interests in private healthcare. He has said nothing about the problems that face the NHS. They come up with manipulative statistics like Crispin quoted at the beginning to paint a different picture. If he was sincere, he would deal immediately with the substitution problem, the downskilling problem. He would deal immediately satisfactorily with the pay theft that NHS staff have suffered over the last decade or two. He would deal immediately with the brain drain. We are losing highly qualified doctors and nurses to other countries. But he's done none of that. All he has done is pretend that their current policies are different to the last government's policies and employed the same people, including Lord Darzi, who produced a report overnight, which, if you could stay up long enough to read it, is exactly like every other report we've had that's got us to this situation. And the big con that they are selling us is somehow by getting big IT companies like Palantir, who've been very helpful to the Israel regime, or other companies to get enmeshed in handling our patient data, and somehow AI is going to come to the rescue. So it sounds superficially appealing, but all these initiatives, if you look and analyze it carefully, they are all providing profit streams for private companies. This is not about delivering care. It's about the perception that you're delivering care and replacing real, tangible care, like a district nurse, with you languishing at home, looking at a screen and getting your data sent to some far off center where you hope somebody's looking at their end of the screen. So it's a way of allowing for partially supervised neglect of the most vulnerable in society. So another recent announcement in the Financial Times is West Streeting's perfectly happy with spending £1 billion in redundancy payment for this bloated elite of the management within the NHS. But, I've been here before. We saw this in 2012 when Sir Nicholson was in power. He sacked a lot of senior managers, but guess what happened? Within a year, 18 months, most of these people were rehired by the organizations that they've set up. NHS England don't celebrate as this some sort of attack on bureaucracy. NHS England has served its purpose. Now we have denationalized the NHS in England. Remember, it's 42 private companies that are publicly funded with autonomy. So they've done their job, and the people who are the most sociopathic will be hired by these integrated care boards. So, why is it left to me and a few others to go around the country telling you all of this? We have very wealthy, strong, well-funded health unions, don't we? And I'm sure you've been to their multiple public meetings that they organize on a weekly basis to inform you about what's happening to the NHS. Or have I got that wrong? Unfortunately, the health unions were nobbled back in the 2000s. Patricia Hewitt got them into a room, got them to sign up to something called the Social Partnership Forum, which essentially said, we will not fight privatization. And they've kept quiet ever since. And that was re-signed a couple of years ago before the 2022 Act came in. Well, there is some resistance, and it's coming from grassroots organizations. One I will name is called Anaesthetists United. They are being replaced by anesthetic associates. Apparently, it's safe to have 3 or 4 anesthetic associates looking over 3 or 4 different operations, and one consultant running between the rooms just in case something goes wrong. Now there's a court case going, a judicial review launched by Anaesthetists United, and they published something only last week about the difficulties they've had, and they found out that part of the disclosure process, part of the preliminary paperwork going ahead of the court case, was the General Medical Council, with its primary function to protect the patients, was involved with withholding evidence of patient harm that the other group could use in their case. So the regulator is hiding evidence of damage. Now, does that fill you with confidence in how we're regulated? For most people to understand what I'm explaining takes a while to get your head around it. It takes a while for us to disband our natural trust, particularly everybody in this room. We have a lot of empathy. We would like to believe what somebody's telling us. But the politicians know the bigger the lie, the more it's repeated. That has a similar effect on your brain psychology as hearing the truth.
I remember reading in the first Labour government in the 40s, that in Attlee's government, that people resigned because they put prescription charges on false teeth and was it glasses, or I mean, that's just so far. We're so far away from that. It's incredible how they've done it. And it's the amount of money I'm interested in. How much money are they getting out of this? I mean, if it's got billions and billions of pounds worth of money they can make, then throwing a few people into PR and management and trying to con everyone in the population isn't going to cost anything like the amount they'll make, will it?
Well, it's not costing them a penny. We're funding it, aren't we? So we are the government is doing their bidding. The government is bringing in the legislation. The government is subsidizing the GP substitution. I'll explain that a bit more. So, as a GP, in my practice, if I wanted to employ another doctor, the practice would have to fund him 100%. If I employed a physician's associate, you, the taxpayer, would subsidize me as an independent practitioner 70%. Now, what are you going to do? Most of my colleagues have said, we'll take that 70%, thank you very much. So we are subsidizing the destruction. They're not taking any hit. They're not even getting a hit in terms of publicity most of the time, because we've almost become numb to one disaster story after another. It's no longer shocking to hear that a maternity unit is scandal-ridden and there's been loads of preventable deaths. How many maternity units across the country have we heard that about? But they've been set up to fail. So yeah, unfortunately, our nature is instinctively trusting, and we soon normalize what's gone on, and they're always ratcheting up scapegoats and diversions. So, there are GPs who've done very well out of this doctor replacement. If you're a GP in a 10 doctor practice, and you replace all the other doctors with PAs, you're talking several £100,000 worth of additional profit. And then at the end of it, you'll sell on to a private company. And the goal will be to merge and amalgamate general practice. Some of that the GPs are doing for themselves, as we saw with the Centene sellout. That will be normalized not to see a GP, right? And in the end, there will be vertical integration. So you'll have these venture capital funds buying out these groups of GPs, consolidating, selling off the assets, and you'll have bigger and bigger groups further and further away, which will vertically integrate with what's left of the hospital system. So there will be a complete grab of power. One statistic I became aware of in America, 99% of the doctors in America work for a corporate organization. That includes primary care and secondary care. There used to be a significant proportion who were independent physicians, but now everybody's been caught up in this medical industrial complex of insurers and providers, and they have incentives that must line up with the corporate directive. And one incentive might be, for example, me as a practitioner, I will be allowed to refer, let's say, 10 people a year for a joint replacement. And if I stick to 10 or below, I will get a bonus payment. And if I refer any more than that, I won't get my bonus. So they are introducing and normalized perverse incentives for your caregiver to deny you care. And most GPs, it's become automatic now, because the process started 20 years ago, whereby they were incentivizing us to do things that you couldn't argue with, check somebody's blood pressure or do a cervical screen. So they normalized the concept that 80% of your income will be based on your list size and 20% is dependent on you meeting targets. The targets seem reasonable at the beginning, and towards the end, you're killing your patients.